Desimon, please tell us about the role of future care in a global level and when and how did future care started?
Future Care started with an idea that began with my father, who was former Federal Rehabilitation Commissioner in the United States. He oversaw for the Veterans Administration and special education schools quality management programs for return to work and vocational skill setting. So I grew up in a family where my father taught all 5 children, I'm the oldest of 5, how important work is to have a meaningful life, both mentally and physically. One must find a profession, a skill, and go to work. With that, we have many challenges when someone's injured or ill or congenitally disabled. My father inspired me to go to school and to do those studies. And eventually, I proposed an idea that became Simone Rehabilitation Services in 1978. And we brought the mission to employers on how to put an early intervention system together for employees who are hurt on the job. How do we support them through the injury? How do we make sure that they reach the right physician? And how do we make sure that they maximize their recovery?
What is the target group of future care?
The target group of Future Care is expressly ship owners and ship managers globally in the maritime community. Many years ago, when I was the company Simone Rehab Services, the Hess Corporation, who owned 50 oil tankers at the time, approached me and asked me to design a service of early intervention medical concierge for their crew that travel on their oil tankers. Their oil tankers did a circuit between St. Croix, Venezuela, and Puerto Rico. And of course, in those days, we're talking about 1985, they did not have a system of doing anything but having a first officer or captain provide medicine from the medicine chest, watch the crew member while he was in his cabin resting, and make sure, of course, he's off-boarded at the nearest port. And there was no system of a physician being able to advise the captain. I was invited on board the Hess oil tankers and shown the different jobs. I understood then the time restraints coming in and out of ports. I understood what happens when they're out to sea, and the only person available to assist an injured or ill crew is a first officer trained in medical or the captain. And I started to evolve this more advanced early intervention medical advice program where we pitch or where we connect a physician advisor in the specialty of what that particular illness or injury is. The program is designed to triage first from a first responder who answers the email or call from the captain, and then we connect to a physician who begins to do remote diagnosis. And we found it to be invaluable to render support to the captain, invaluable to ensure that the proper medicine and treatment was being utilized from the medicine chest available, and invaluable for the crew member to know that he was truly watched over by a doctor.
Which are your services?
Future Care Services run the gamut of physician advisory at sea through port-side medical case management of the medical facility or the hospital, depending on where the crew member has to go. We have developed relationships with hospitals and facilities in most major port of calls over the last years, over 10 years. By doing so, we manage an affiliation of trust. We pre-certify the care and the specialties of that hospital and facility, and wherever possible, we steer and direct the captain to utilize that port facility or that hospital because we know we have high regard and that they work well with Future Care. Again, we feel that maximum medical improvement from an illness or injury occurs best if the correct medical specialist is assigned to work on the case. So Future Care has physicians in many specialties, and we know our hospitals and our facilities where we can find the specialty at hand that we need at the moment.
How fast and flexible are you in the case of a serious incident?
In the case of a serious incident, we have an emergency hotline. We have the availability for the captain or first officer to call us and immediately ask for help. Our first responder immediately connects to our physician advisor in that part of the world. We have 5 physician advisors placed strategically around the world, and so that they're on a daytime equal to where that ship is. They are there to assist the ship owner. Everything is done by email. Satellite phone is used to a minimum because we want the exact instructions to be understood and our questions to be answered. And in many instances, by speaking over the phone, you may have selective hearing. So, and of course, if someone wants to speak to our physician, we are there to patch them through. But I can tell you that most of our work is done through email communication, digital photos, and instructing the captain exactly what to do with his medicine chest and starting treatment on board the vessel before they actually reach port. And that is the key. Don't give the medicine that you think he needs and put him in his cabin and decide that it will be okay to travel 3 or 4 more days. Let Future Care know right away from the first hour, and then we will monitor him and his vital signs until he's reached port.
Do you insure only crews, the staff of ship managing companies, or both?
We work directly with ship owners who, in many instances, hire ship managers to provide crew and captains on board their vessels. So, in the instance that the ship owner understands his P&I Club experience is a mitigating factor if he does not handle his crew illness and injury correctly on board the vessel, the ship owner who hires Future Care will advise his ship manager that they are entitled to use our medical call line for medical advice. We now have so many ship managers that use our program around the world, including Anglo-Eastern, Wilhelmsen, and Wallam, that now they too sometimes hire us directly. Our ISO quality management certification is a long and arduous process, but we welcomed a team from the ISO organization to come to Future Care and work with us for several months so they understood all of our teams, our medical teams, our nurses, and our first responders, as well as our admin, and they studied and understood how we work our time frames, and we have been wonderfully approved over the last 5 years. Each year they come in and they do a recertification. We're very proud of that.
What are expenses for a ship managing company that follows your program?
Expenses vary, as do the nature of the illness or the injury. But basically we charge a per hourly rate per incident, and that is done in 6-minute increments. If a case takes us 2 hours, it is closed. We medically, legally document everything. Our tasks may be as simple as a doctor explaining to a captain why, after the crew member has eaten a local fish, why all the crew is not feeling very well. And it may be a simple answer and the case is closed very quickly but documented. That may be only a few $100s. In the same instance, we may be called because a captain thinks someone is having a stroke or a heart attack. In that instance, we take many hours and we have our physician talk with the crew member and the captain and really come up with a diagnosis, treatment plan for immediate resolution as best as possible, and then they make the determination if a deviation of that vessel has to occur to the nearest port. Once that occurs, we've already alerted the local hospital to expect the crew member. We've arranged transport and we've contacted the port agent who assists with the transport. All those things may take 10 or 15 hours, and then the the ship owner will be receiving a bill in 15 hours. But what occurs that is very important for a ship owner, at this time, without a full program like Future Cares, they don't specifically count every small medical incident that occurs on the vessel. They may, of course, count and make injury reports or illness reports, but are they calling in everything? Our program says you should, because then at the end of the year, every incident they called in to us that we addressed medically and that we documented, we can show them the average cost for our work on all those cases.
What are the benefits for a ship managing company whose crew is insured through Future Care?
Well, the benefits are that we reduce repatriations, we reduce unnecessary portside medical calls for treatment, and we reduce deviations. And we monitor and manage truly that this occurs so that at the end of the year, the ship owner or manager gets a risk analysis, and the case where we avoided the deviation is sent in detail what we did, how we were able to avert that. And of course, we're not saying that we can avoid every deviation, but our doctors stand by the fact that 96% of all deviations asked for by the captain are not medically necessary. So that means that a primary health care service on board the vessel to take care of all small incidences and encourage the crew member to ask the captain to have us treat them is very, very important, because we see that we're minimizing the chances that many of those small medical incidences become larger. And we have the proof of that.
Why you choose this topic to present here in this seminar in Posidonia exhibition?
Well, the Forum of Posidonia is a global forum admired and respected by the maritime community. And so it is my honor to be able to talk about new ideas that I feel will present a paradigm change that will assist ship owners in being more comfortable in utilizing a physician advice at sea program and a concierge program for the correct hospital or facility portside. And inviting Yale to study Future Care statistic was important because Yale's specialty is occupational medicine. That means they think the seafaring community and seafarers are a unique population to study, and they were excited to join Future Care in the study, and again, to help alleviate fears that the kind of paradigm changes and enhanced healthcare solutions we suggest are not important. But to have Yale there by my side to explain that they are useful, cost-saving, and a wonderful extra service to offer to seafarers who don't want to be afraid when they go to sea that something will happen.
You have a branch in Athens. Which are the services that you cover?
Our 24-hour call line is covered out of Manila, Philippines, and the U.S. So our first responders, who are the very first ones to answer a phone call or an email, are located in those offices. Our Athens office is a business liaison and educational office. Miss Lucy Sofronis is in charge and is here full-time to help the ship owner with individual medical cases they wish to discuss, or to explain the entire Caring for the Crew program to them. So again, this is our correspondence office here in Athens. Our operations takes place in Manila and New York.
We're very happy to have a Future Care office in Piraeus in order to assist the Greek ship owners with managing the health care of their crews. And we found that recently, particularly with MLC, we've had an enormous interest in our services, because Greek ship owners, they care about their crew, and they understand now that the crew have a right to speak to a doctor on board, and we're here to exactly provide that service. Well, the most important thing really is to keep those people at work and to get them back fit for duty as soon as possible, giving them the best health care at the best price. And that's really what we can do. Our aim is to keep these people at work. So we want to identify as soon as they have an injury or illness on board, and the captains are able to email our doctors and to immediately get a diagnosis and to get assistance at sea. And in most of the cases, we're able to treat the crew member on board. So there's no need for him to disembark the vessel, there's no need to have a deviation, many deviations are very costly and also unnecessary. However, if the crew member does need to receive medical attention, we have a network, an international network of port hospitals all around the world, and we are able to book the crew member, whatever his nationality, into one of these hospitals. We also agree the hospital rate from the onset, so the ship owner is not overcharged for the treatment. The crew member is given the best treatment, and the aim is to get him fit, ready, back for duty as soon as possible.
As you know, Ms. Sofronis, any Greek shipping companies are small. Your program can cover all level of Greek shipping companies.
Absolutely. We have some Greek shipping companies that have taken our service, and they have maybe 20, 30, up to 50 vessels. But equally, we are very happy to work with some of the smaller to more medium Greek ship owners, the family-owned shipping companies, 2, 4, 5 ships. Yes, we can provide an excellent service. The crews are human beings. They're not robots. They are going to get ill on board. And it gives the captain a great peace of mind to know that he has future care there to assist him with all medical matters, and to the crew also, they feel that they're looked after by the ship owner. So yes, we can deal with all types of sizes of fleets.